Buluminaka. Following the screening of 16,613 Fijians and another 1,018 tests yesterday, we have one new case of COVID-19 to report. I'll get to the details of that patient shortly. Before I do, we have some urgent developments to cover that require immediate changes to our containment strategy. Our contact tracing stemming from case number 113, the government factory worker is in full swing. There are two factories that we were focused on. One is Landhurst, the factory in which he worked, and the other one is the Mark 1 apparel factory. Employees of these factories used to travel to and from work on the same company-provided transportation. So we've treated both these factories as potential source points of further transmission. Starting last night, our team have run an exhaustive all-night contact tracing exercise of these at-risk employees. Before the sun started rising, samples went for processing. We have 877 employees in total that we need to reach. 321 have been identified, screened, and swabbed. We have no positive cases to report at this time. If you work at Landhurst or the Mark 1 apparel factory, and my teams have not been in contact with you yet, please call 158 now to help us reach you as quickly as possible. There are still hundreds of employees we need to contact. The vast majority of these individuals reside in the Suvarnasori areas. We cannot waste another minute locating the rest of them. So to allow my teams to find these Fijians quickly, we will be locking down the Suvarnasori containment zones from 2000 hours tonight until 0400 hours Monday morning. Rather than operate two separate containment zones, the Suva containment area and the Nosori containment areas will be consolidated into the Suvarnasori lockdown zone. The borders of the lockdown zone mirror that of the two containment areas, and the police will be operating checkpoints at Longani Village, Sawani, Tamaboiwai, Bridge de la Vesi, and the checkpoints at 8 Miles Bridge near Roop's Big Bear will be uplifted. To those living in Suva and in Nosori, we have all been through this before, and we all know what it means. The Suvarnasori lockdown zone will be under curfew for at least the next 56 hours. No one should leave their homes. I say that again, within the lockdown zone, no one, no parents, not breadwinners, not children, no one should leave their homes. The police will be enforcing that movement restriction. Without ministry approval, you can only move from your home for medical emergencies, and this exemption will include kidney dialysis patients. For the duration of this lockdown, no businesses, including supermarkets, banks, and pharmacies, are allowed to be open. Some essential services like water, power, ports, and private hospitals will be allowed to operate with authorization granted by the ministry. And we will work directly with essential service providers on those arrangements. Deliveries across the lockdown zone borders will also go on hold, as there will be, not be any markets or supermarkets open, so delivery services do not need to operate through the weekend. As I mentioned over the past few days, lockdown is a measure of last resort. We determined at this stage a snap lockdown has become a medical necessity for the Suva-Nosori corridor. But we recognize that the nature of this restriction is going to make accessing basic services extremely difficult over the next 48 hours, if not impossible. We have ordered food packs that will be delivered throughout the lockdown area for Fijians who run out of food. If you live in the lockdown area and need access to this emergency food supply, you can call toll-free number 161 from 9 a.m. tomorrow morning. We ask that you be patient. Your calls will be answered. To make things efficient, please make sure you have details like your name, location, and number of family members, and the number of family members readily available. Deliveries will be scheduled throughout the course of the weekend, and we will come to you, so there's no need to leave your home. On Sunday, we're going to look carefully at what our contact tracing and testing tells us and make a medical determination of whether the lockdown should end or extend. Now I'll speak to our new confirmed case. The patient is the wife of case number 110, the first individual in Ra who tested positive for the virus earlier this week. Remember, we've had another case in Ra, case number 116, which we announced yesterday. So this makes a total number of 3 cases in Ra, forming 2 clusters. We do not know where either of these clusters originated. We are continuing to investigate any possible links with existing cases. We also sent samples of the positive results of our most recent cases to our reference lab in Melbourne to see if there's a genetic link between these latest cases. We are also investigating the possibility that these cases originated from earlier announced quarantine facility breach. I want to explain exactly how that may have happened. The incubation period for the virus is 14 days. That means from the moment a person comes into contact with someone with the virus and gets infected, it can take up to 14 days for the virus to cause symptoms or register a positive test result. Only after we effectively quarantine an individual for 14 days and they register a negative test result do we know that they do not have COVID-19. But that assurance comes from the fact that we are certain the individual had 0 exposure to the virus for every single day of a 2-week quarantine period. Because if they came into contact with someone with the virus during the 14-day period, ideally the incubation period needs to reset for another 14 days. At the Tano Hotel, due to the breaches at the border quarantine facility, there could have been infectious staff who transmitted the virus to individuals during their 14-day quarantine period. That means when we tested them at the end of quarantine, we could have missed a soon-to-be positive patient. In the case of those discharged from Tano from the 12th of April onwards, that's exactly what we were concerned might happen. One of these individuals, that's case number 114, has proven that point to be a valid concern. We have contacted 93 out of the 96 individuals discharged from Tano Hotel Quarantine Facility from the 12th of April 2021 and onwards. These individuals are being tested and will restart their 14-day quarantine. One of these cases may be the source of the outbreak in Ra. We simply won't know for sure until these restarted periods of quarantine are complete. In the meantime, we have no choice but to treat the first 2 cases in Ra as instances of community transmission, which are cases that have no known link to other cases or international travel. Yesterday, we published a list of contact tracing areas of interest online. These are main locations we know about, but it's not an exhaustive list. The mere existence of of community transmission means that there are high-risk locations in Fiji that we do not know about. So please don't read that list and think simply that you are not in any of those areas, therefore you are not exposed to COVID-19. You still could have been. If you've been anywhere outside your house, there is a chance that you can contract the virus. Every time you leave your home, that risk increases. Certain areas of Viti were already cordoned off into containment zones. Functionally, Ra is already separated from major population centers. However, to ensure strict restricted movement within the province, the Fiji Police Force has set up containment area boundaries for Ntokonivatu, Nanukuloa, Naiseralangi area, and the Naria area to ensure no unauthorized movement across the borders. Starting at 8 p.m. tonight, the capital and the Nosori corridor will be on a war footing. We have 56 hours to break as many chains of COVID transmission as possible. My teams, alongside that of our disciplined forces, will take full advantage of this opportunity to get ahead of the spread of the virus. In the lockdown zone, we want zero public movement. There'll be no one on the streets unless you're traveling for a medical emergency or the ministry has issued you a special clearance. It will be considered an offense and the police will arrest you. For the rest of Fiji, essential businesses such as supermarkets are open, essential travel movement is allowed, and normal curfew hours from 11 p.m. to 4 a.m. apply. But we are urging everyone to please stay at home. Make this a family weekend. Keep your children with you. Every time you leave, you risk bringing this killer virus with you. If you absolutely do have to leave, wear a mask and make sure you have your Care Fiji app installed, turned on at all times. If more Fijians have downloaded the Care Fiji app from the start, we wouldn't be in the position that we are in today. If we see gatherings or large numbers of people moving about elsewhere in Fiji, we won't hesitate to extend these lockdown measures to other parts of the country. There's nothing easy about the task ahead of us. Every decision we make, every decision we make will be defining for the security of the country. That applies to my teams. It applies to each of you watching this address. It's tempting to treat this as a moment of deep despair. But my teams, we see it as an opportunity. As our opportunity to contain the virus. We need your support. We need your cooperation. I assure you, we will return it tenfold through our efforts to free Fiji from the grasp of this outbreak. Together we can, together we have, and together we will once again. Thank you.
Thank you. So as announced by the Permanent Secretary for Health and Medical Service today, we have one new case to report. With this latest case, there are now 50 active cases in isolation. 5 are older border quarantine cases that were announced before Sunday, April 18th, and 14 are recently announced border quarantine cases. 29 cases are locally transmitted and 2 are still under investigation to determine their source of transmission. But for now, we are considering them as cases of community transmission. Fiji has now had a total of 117 cases since our first case was recorded on March the 19th of 2020. We've had 65 recoveries and 2 deaths. A total of 51,014 tests have been conducted to date, with a daily average of 774 tests per day over the last 7 days and a weekly average of 3,485 tests per week over the last 2 weeks, with a record of 5,169 tests done last week. So testing, of course, has increased in line with our response to the recent cases, and yesterday we conducted 1,018 tests over a 24-hour period. Our overall test positivity is 0.2%, and our 7-day average daily test positivity is at 0.7%. Thank you.
Thank you very much, Dr. Lish and Dr. Fong. Members of the media, we are open to questions. Please state your name and organization. We will also have one question each from each organization.
Dr. Fong, Marioni from Fiji One. So can you explain why the ministry did not inform the public in advance about the lockdown, considering the people rushed to supermarkets and started panic buying, especially in high-risk areas such as Makoi?
Yesterday, if you recollect my speech, I did say that there's a good chance that we could do it. We could have to do a lockdown. what happened was that we tried to collect data last night to inform us whether a lockdown was necessary. Unfortunately, it turned out that the data that we had last night, there was a lot of missing information in terms of contact details, because the team ran around last night trying to find as many individuals as possible, and then so we had a lack of data in the morning. By this afternoon, finally at around 1 o'clock today, then we were able to get a full idea of the contact details, so that we were able to, actually we had a bigger number of people that we had to contact, but after the history it reduced to 877. Now that we know what we have to do, together with the contact details, then we looked at it and we decided, no, we can't do this because the people are so spread wide. We can't do this just by going to one locality or two localities. It's too spread out. So then we moved towards announcing the lockdown. The data that informed us was about 3 o'clock. So from 3 o'clock, then we have to start reorganizing a lot of other logistics to support this lockdown from 8 p.m. Of course, I mean, it did mean that my press conference was going to be a bit late. It does mean that we have to sort out some passes for you to be able to return home. But it is what it is. I mean, I guess what we're getting at, we don't like, the Ministry of Health doesn't want to start initiating action until they got all the pieces of the puzzle to be put together. But there was some warning that was given from yesterday of this possibility. And I did know that I could see that some people were heeding it already, even before we announced the lockdown.
Dr. Fong, Eva from Fiji Village and Najin FM News. So can you just highlight how many people from the Tavakumbu funeral and the Nandera church service have actually come forward as of today?
From the data that we discussed this morning, everybody that we were looking for, we found from both places. They, again, what we are doing is that from the Tavakumbu area, during the 14 days, they'll be running a screening program to cover the Tavakumbu area at least 4 times. Like, go around, do one screening, then come back again, screen again, then go screen through that at least 4 times. And we are looking, because a lot of the funeral movers were within that area. So around the Tavakumbu area, they're doing it twice. There's a zone around the Tavakumbu area, which is the yellow zone, and they're running that screening twice. And based on the numbers and the results we're getting more and more confident that we are cleaning, that place is getting, more confident about the cleanliness of that place.
Tali from the Fiji Sun. Can you just give us more information, specifics regarding the food packs that the ministry will be distributing? How many Fijians are you able to cater for during this lockdown period? How much worth of food rations do you have?
For now, it's 30,000. That's what we got right now. There is the ability to produce more. There is arrangement with Punjas to produce, to have this production going. And we actually will have to sort out some passes for the workers in Punjas to be able to keep producing these packages for us. And then there will be movement of freight and food overnight, so that it can be positioned somewhere in Suva and there's some positioned in the west, but there'll be a lot that will be positioned in Suva for the purpose of what we're doing, because the lockdown is only in Suva.
Dr. Fong, Lena Reese from FBC News. With the curfew being imposed from tonight until Monday morning, what does this mean in terms for the media?
From what I understand is that all essential services that we deem essential will continue. So we will sort out that detail, but any essential service that we can consider essential, we will allow to function. It's just that all the passes will have to be done with some difficulty starting tonight.
I just wanted to go back to your speech, just on his speech. You mentioned there were 93 out of 96 individuals that were called back to Tanoa. They've been tested and they're restarting their 14-day period. What of the other 3?
I haven't got enough information on the other 3. I noticed it while I was talking, but I did recall that one discussion that we had that some may not actually be in the country. So that's another discussion that I'll have to confirm again. Sorry, I did not actually follow up on that detail prior to this. It was something that it escaped my notice until just as I was about to read the speech, yes.
Dr. Fong, about the food packages that will be distributed to people living along the Suvarnasari corridor, what can people expect? What materials can they ask for if they do call the helpline and they...
From what I understand, there is mostly non-perishable food that will be available. The helpline they got is 161. We've got a place that will be stored in, and the military have actually said they will help us distribute it. So once you get the number, then we start pulling together a few distribution, 3 packets, and they'll distribute it according to the house that asks for it.
Dr. Fong, Litya Dabar from the Fiji Times. So just with regards to during this lockdown period, and that is if you could tell us an estimate, if you have an estimate, and that is on the number of people that the ministry is looking at to do contact tracing and also testing, in order for you to be comfortable as to where we are right now.
Okay, when we started, there was a discussion of having about 20 teams with 3 persons per team. I think that's the question you're asking. Okay. That was at about 3 p.m. That was the thought process. But as we finished the meeting, apparently we do have a lot more. And they'll be going in groups of 3. So they'll be starting, we have divided them to start from each end. And there's a strategy of how they're going to do the coverage. The other thing to remember is that at 1 p.m., we got stronger details about the address and the phone numbers. We were not going to do we were talking about the lockdown for a while, but we didn't want to do it until we actually knew that it's going to be useful. And we knew it was going to be useful because we have enough teams to run around, and they're going to go to specific places that we have verified to be the place where we need to go. So that's why we're saying this lockdown will be useful, because we know where to go. It would have been a bit more difficult decision if I didn't know or I wasn't sure of the addresses of each of the individuals we're talking about. Yeah.
Are you looking at a targeted number?
Oh, there's 877 I mentioned. Oh, sorry. It's less by 300 or so. I mentioned about 300 or so that we've already found and swabbed. So it's about 500. It's about 500 and something that we're looking at. But we do know their contact details.
I'll probably just add to the results of the test for these 500 or so is very important as well. If we get one of these garment factory worker colleagues testing positive, that will even increase our contact tracing again. Yeah.
Dr. Fong, Parama from Fijian News. I just want to ask if you can give us an update on the conditions of our active COVID-19 patients. How are they doing? Does any one of them need ventilators? Considering that this is one of the dangerous variants.
I'm glad you asked that question. Yes, they're doing very well at the moment. There is nobody who's critically ill, and from the update I got this morning, nobody was getting more ill. So we are quite happy with the condition at the moment.
Dr. Fong, can you just give an update whether people who will be dialing the number 161 over the weekend, will they be paying for the food packs they'll be getting?
No, it's free.
One last question, sir.
I just wanted to go back to the initial case, the couple that came in from India who tested positive while in a border quarantine facility. I wanted to ask if whether you'd be able to clarify what their purpose of travel to India was, and if it was for medical grounds, who out of the two went for medical treatment?
I actually don't know the answer to that question. Yes, when we were accepting people from India, the only reason we closed it was because we knew that there were some people coming across after medical treatment. And it's not going to be easy. If I allow some people to come, it's not like very hard for us to go and say, okay, you can come. No, you're not allowed to come. So we just knew that there is a significant group of people in India who are considered medical people. So we've left the door open. But that person in specifically, I didn't catch up on the detail.
Thank you very much, Dr. Fong. Thank you, members of the media. That also wraps up our press conference for today. Pina walewu, and we hope to arrange your passes so that you can go home safely. Pina walewu.